Coming up on Vet School Confidential.
This is going to be my first time going into an equine surgery.
It comes back so big.
It was rescued from a puppy mill.
These guys were rejected, so normally they just kill them.
I'm going to go down to Louisiana, and I really can't wait for that. My second semester of my second year in vet school just got really, really challenging for me, and I ended up having to take some classes over again.
Wednesday or Tuesday?
And that was really hard to tell my family because I was always known as being, high achiever. But I got through it, and I strived even harder to get through my classes because I definitely had to prove to myself that I do this.
Vet school is a challenge. There's no doubt about it.
Yeah.
I don't know, it was a little stressful, but that's the reason for going into it.
Yeah, I feel incredibly lucky. I find it hard to believe sometimes that, that everything has worked out the way it has. That since I was little, I always wanted to be a vet, and here I am. I'm making that dream come true.
Equine clinics, it details working with horses and also can deal with working with mules and donkeys. Any type species that is equine related, not just horses.
The horse's name is Bailey.
How old is he?
He's 10.
My interest in veterinary medicine is mainly towards equine. Since I was raised around horses when I was younger, this is where my love is working with horses, and it's what I was raised around, and it's what I like to do. Come on, Guy.
I'm here to see what kind of treatment I can get done on this sarcoid so it doesn't keep coming back. I'm getting nervous now because it comes back so big and pussy.
I'm just trying to feel how big is this stuff.
Sarcoid is a wart-like lesion. If you have a wart on your hand, but it's a lot larger than that and it continues to grow. Oh, sorry, Guy. Shh. That's so gross. You see so many different things in vet school and different diseases that all these animals get, and now come into the clinic. It's just like, wow, I never see that before.
I've had it frozen off before and it just hasn't done anything. So I decided to have them do the surgery. They're going to remove the tumor and inject chemotherapy around the outer rim of it. It does make me very nervous still. Leaving your child here in a hospital and wanting to, the best treatment.
You really realize how important veterinary medicine is to owners and to this world.
Oh, you slide in here?
Boys, come on. Yeah, boys.
This is cardiology. This is an elective course. You don't have to take it. I'm on with 3 of my classmates. And this is my first patient of the day, Moppy. Moppy, that's fitting.
They came from a puppy mill in Missouri. They were, what happens is the puppy millers sell them to brokers that sell them to pet stores. And these guys were rejected by the broker because they had heart conditions. So normally they just kill them. Just bonk them on the head or drown them.
She rescued it, and now it's got a second chance up here, hopefully. The hope is that once you repair the cardiac defect, they'll find a home for them and they'll live a long, happy life.
They're part of the family.
As soon as you put your stethoscope on their chest, you'll be able to tell that, wow, there's some significant changes going on in his heart and lungs. PDA stands for patent ductus arteriosus. It's where a vessel should have collapsed and scarred away, but it hasn't, and typically they'll die without correction.
It's a win-win situation because Dr. Eister has residents that need to learn how to do PDAs. They've done at least 5 PDAs of ours, and they've all survived, and they're all doing wonderful.
Was that your friend? When you hold him, you can feel the buzzing on his chest, an abnormality in his heartbeat. You almost don't need your stethoscope.
I like to give
Give me about 10 seconds.
Yeah.
Pretty confident it was a PDA. It was a typical murmur that you hear with a PDA. It's got a different beat or a different tune to it. That murmur is pretty telltale for the disease that's going on.
When we return,
I'm nervous, but I'm kind of antsy too because I want to get in there and do something.
There's just always that concern that you've missed something or didn't do something right.
We're getting Bailey ready for his surgery. We'll remove the tumor or the sarcoid. Come on. Come on. Hey, Benji.
Okay, let's do it.
This is gonna be my first time going into equine surgery and helping out. It's hot. Hot. I'm nervous, but I'm kind of antsy too because I want to get in there and do something.
So the thing to do is to have Rachel lay the blade on there and just do a complete trim from top to bottom.
It's really exciting that I'm going to be able to be in there.
You want to come to the back and then just go to the back to the horse.
Place it on the horse?
Yeah, place it on the horse.
I didn't think that I'd be able to do anything. I thought I just was able to hold the instruments and give them to him, but he actually let me cut the whole tumor off, so that was pretty exciting.
I will just take it right here, okay? Just take it like this. Okay.
He said just
Now
don't
you
cut.
see that? Yeah. You see how where do you start? Just
Like right there?
parallel. Yeah, there you go.
Okay.
Okay, now just keep. Okay. Easy. Okay, keep going. Is that cutting?
Uh-huh. Slowly though. It was thick and it wasn't really easy to cut through.
Okay, keep going.
Removing that tumor, and I just wanted to make sure I was getting everything straight.
Okay, that's perfect. Okay, that's it. Who can take this for me?
I'm really glad I'm in clinics now because it's just I'm really getting the opportunity to work with many of the clinicians, and they're seeing my skills and seeing that I can work with animals and I know what's going on.
I mean, we can take this out of him.
Now, you see that one? You want to inject that one. Okay. Real fast. Yeah, there you go.
Okay.
Fashion statement here.
Careful.
The chemotherapeutic agent that we used is very dangerous, and so that's why we need to wear shields and protective gloves.
It's hard.
Yeah, it's really hard to get in. There you go. That's good. Okay. That's a pretty aggressive looking tumor, so we need to bring this one back and get another set of injections on the horse.
Hopefully, Bailey will not have to worry about the sarcoid growing back in that area again.
Bobsled, let's go.
It's okay, Bailey.
Careful, right?
Beautiful.
I haven't heard a lot of murmurs at all, and Dr. Eister expects us to pick up on those right now and be able to diagnose them and to describe them.
About 10-15 minutes more.
In comparison between the two dogs, This one has more distinct heart sounds. I talked to Dr. Eyster. It is a continuous murmur. What's going through my mind is, geez, is what I found, what he'll find. Still thinking PDA.
Just take a look at him.
There's just always that concern that you've missed something, or he'll find something extra, or you didn't do something right.
Morning.
These are not typical murmurs, and this is not a PDA.
Okay.
Where's the loudest?
I thought left.
Where?
Right here.
They're cranial. Far cranial, okay.
Yeah.
So you're hearing them both in the, what area?
Pulmonic.
All right. So we get pulmonic stenosis here, not PDA. And either.
I'm just a little hard on myself and hate to make mistakes.
Attention. What are we going to do to...
It was a rough morning. I wasn't right in my diagnosis, but that'll come with experience.
So what are we going to do to make the diagnosis?
In my case, you could do it with echo.
And we'll probably do echoes on your dog for sure.
Hate to look like an idiot in front of the clinician, but stuff like that happens. And that's the nicest way to say it.
Get Rads and I'll meet you down in the echo room.
If you're afraid of being wrong, then you're in the wrong place. But then on the other side is you always want to get everything right, and you want to look like you have a clue to your classmates and the clinicians. I mean,
I used to be hesitant to ask, questions. I was like, oh, maybe it's just me who doesn't know. And then
certain
Then I would-
clinicians
then
will
I
make
would
you feel that way.
I would ask people around me. I used to ask people, and they wouldn't know. And then I realized, you know what? I should just ask.
At least they know that we're thinking about it. Even if we're wrong, at least they know that.
Well, you're going to be wrong.
If you've never failed, you've never tried.
Oh, Lord, here we go.
Gosh, getting a little
Kent's philosophy. So you might as well just take my stethoscope away from me and slap me in the back of the head. Tell me to go back to dermatology.
Dr. Einstein, we're doing an echo in the echocardiogram room. Dr. Einstein, we're doing an echo.
When we return,
He's too small to do operating on right now.
I'm in Louisiana at my mom and dad's ranch, but I gotta just hold him.
We decided to do an echo on each of the little puppies.
Right there, I don't like that. A lot of turbulence there.
It turned out that both of them had pulmonic stenosis, meaning that one of the valves in its heart that leads to the lungs isn't functioning properly.
It's interesting because this guy's still pink.
Moppy turned out to be, unfortunately, it was something worse, something a little more complex, and carries a guarded or a worse prognosis. Tetralogy of flow, which is the hole in the heart, pulmonic stenosis, right ventricular enlargement, and an overriding aorta.
What can we do medically to maybe keep this from getting any worse?
That's 4 different heart defects. He's too small to do operating on right now. So what we're going to try is a cardiac medication, and that should hopefully buy him time so that they can possibly do the surgery on him. It's a pretty grave prognosis for him. Not good news at all.
Sorry, buddy. I wish I was right with the PDA. There's a lot to learn in every rotation, and you try and pick up the most that you can. And you make mistakes, and you learn from them, and you put it all together, and you go out and practice. Yeah.
Bailey's owner is here, and he's going to be leaving today after his surgery yesterday. Bailey. Hi, Bailey. Hi. Hey, guys.
He's gonna be glad he's going home.
It's just really nice to see that you could actually, not actually helping an animal, but you're also helping a human as well.
Okay, we're gonna go, Bailey.
All right.
He wants to go home.
Yeah. So,
Well,
hopefully
thank
need
you.
more treatment.
Thank you very much.
No
All
problem.
right. Okay.
Have a safe trip.
All right.
It's really nice to see owners go home happy. Well, we hopefully like to do that every time. There's always ups and downs in your life, and it's definitely going up for me right now. So I'm going home this weekend. I'm gonna go down to Louisiana and visit my mom and dad, and I really can't wait for that. Hey! Come on, what? I'm here in Louisiana at my mom and dad's ranch. My dad has a lot of trotting bred ponies, and he uses them to harness race. This is just more of Dad's pasture land, and over here is where we have some sheep and goats that Dad keeps.
I'm Rachel's daddy, father, any way you want to say it, I guess. And she's here, I guess, on vacation, a couple weeks. And we really enjoy having her here. As a matter of fact, she can help with the vaccination with the horses.
I thought you said you want me to start in the barn. I'm gonna go vaccinate the ones on this side. It's so dirty.
We waiting on you.
How many is in there?
A bunch. 1, 2, 3, yeah, a bunch of them. Yeah.
We're vaccinating them for tetanus and sleeping sickness, encephalitis.
You need an apron or something to hold them on in.
I know. Oh, Earl. Oh, Earl.
Yeah. That's your horse.
Dad's really quiet. Like when we were growing up, me and Dad, we really didn't talk that much, except if anything we had to talk about was about horses.
Oh. That's good enough. Where's his hog?
I adore my father very much, and he was one that didn't really care for me to be in school. He wanted me to keep helping him race horses. He had said to me, because I had to call him one time, and he's like, "You're not doing anything for me. Why do I need to help you?" And he didn't realize, like, I'm doing a lot here. I'm like, gosh, I'm trying to, make you proud and like going to school. And so after he said that, I pretty much was like, forget it. I'm just gonna do it on my own. But I got it. Just hold him. Hope. He'll be all right. Hope. Hope.
Hope.
Hope. Hope. He's done. He's mad. Oh no. No rest. I'll rest when I get back to school, I guess.
When we return,
Oh yeah, everyone wants me to come back here and stay. Everybody. Oh. Oh my goodness. Chill out. He's done. Oh. Oh my goodness. Chill out.
All right, come on.
I'm very different from all my brothers and sisters. I mean, I pretty much am the only one that continued on and wanted to get a college education. It was just so overwhelming, and I was like, oh my gosh, and I was like, okay.
Yeah, that's all right. Go ahead, Rachel.
I wrote my father a long letter and explained to him, and I mean, it was pretty emotional and stuff, and about like, you know, I'm trying my best and I'm trying to make him proud and all this stuff, and so he called and was like, I'm sorry for never helping you. He's like, I didn't realize how much, you know, it mean to you and stuff like that, so it was like a dream come true actually, because I was like, oh my gosh. It was just really amazing that he helped me like that.
Well, she always liked the horses and stuff, you know. We always been dealing with horses together. And that just make it more interested that knowing now she got a career out of it, you know. I mean, maybe someday she can give me a job.
Oh yeah, everyone wants me to come back here and stay. Everybody.
I won't have to be out calling for a vet if I need one. That's one reason for sure. And the other reason, I like to have her closer to us. She is the baby.
There you go. We had this 4-H meeting when I was a lot younger in high school, and I told one of the parents that, you know, I want to go to school to be a vet, and she's like, oh, I wanted to be a vet.
Really funny how they say it to me, you know.
It is kind of flattering to think, you know, that all these different people want to be where you are, and I feel very lucky to be where I am right now. I'm achieving my goals, and now I'm, you know, about to make the dream a reality.
Yeah.
And so, you have to feel lucky.
I respect him greatly because if he would have never introduced me to like horses or to any type of animals, you know, I feel like, you know, I wouldn't have really known about anything about wanting to get into vet medicine or, you know, or have the love of animals like he has. Yes, I'd like to make my family proud, but I do like to make myself proud too. I mean, and to know that I can succeed in something that I really wanted.